Year 2020 saw an unprecedented surge in gender-based violence. The COVID-19 experience, with its attendant lockdown and hardships, aggravated an already heartbreaking sad situation with results of monstrous proportions. That, as is globally, is the sad case in some parts of Akwa Ibom State, Nigeria. Spine-chilling or shivers-raising are the lighter of the feelings relieved and the threatening and harrowing survival accounts of the heinous acts of gender-based violence inflicted on the victims by the perpetrators. The acts include incest, rape, assault, threats to lives, and so many graphic and emotionally destabilizing violations.
I was being raped by my father. 2012, that was my 13 years old. He first of all, there's a day he came back. He asked me to come to his room and stay with him. My stepmom wasn't around. He has this habit of beating his wife. So that day his wife wasn't around. So he called me to his room. While I was still there, before I could notice, he was on top of me. After that, he told me that I should not say it to anyone. He even opened a Bible and placed a curse on me that if I should say it to anyone, that God will punish me. I was unable to do anything at that age. I kept it to myself. That was when I started seeing my menses. He later come back and asked me if I've seen my menses since then. I told him no. He said that I am pregnant. He called my mom. Ever since I left my mom since 2008, he hasn't called my mom. But that was the month and the year he called my mom that my mom should come and carry me, that I'm pregnant. My mom came. I was unable to tell my mom because I was influenced by his curse. I was unable to say anything. I carried out the first abortion at my 13 years old. He did the first one. Coming back, the very first week I came back to his house again, he did the second time. And I got pregnant again for him the second time. After that second time, I came back again. He still continued doing it to the third time, the third time, I almost lost my life because the pregnancy was up to 4 months.
I came and stayed with my father at 2019, and my father died. I was staying with my auntie. Then after then, one of my friends came and asked me to come and stay with her. So after then, I went and stayed with my friend. It was 12 o'clock midnight, and the girl now come and called me. And I went outside to go and meet the girl. So she now took me to her uncle's house and said that she want to go and collect money. So then I now follow her. After then, the girl now said that she want to zip Gary. So the girl now took money and go and buy the Gary and come back. So we now zip. After then I slept off. I don't know what happened. Around 1 o'clock, and I was raped. Blood was over me. I couldn't breathe, and everything was just like that. She tried to use hydraulic on me. I tell her to not use it. The girl took me to former Castaway, and I was late. Everything was just like that. People were looking at me. Immediately, I was in the hospital. They now treat me. After then, everything was just like that.
Okay, January. C'était me amayon se kang pastor me ke wawan ayup. Se yiri kayup ke February. Okay, 25. C'était me yon e kayup ode mairi I pupi. Etong elisa. Se amakim se bini kay ke donke. Isi okefe. Se bini ke don. Aminge bago iti ese nama yobdo so ayo maka so minong loko fewalan sung na ngedong sung na I came around 8 o'clock. So pastor me young afi adi I mean monge na go for because of all the upstairs Aminge na ukang awal. So pastor lo di room aminge na. Ay madaya. So anya dog be de minge na kine suona. So the next thing ngom nya awum amfi. So game fi kami bo me ni with so pastor lo ki mo ke. So mình mua bài em bận tâm mê tìm mẹ bận tâm mẹ cái tìm mẹ ai nhong đi cái mỏ và so mình như mình đã cần đăng càng cái này tìm mình nào càng xong rồi anh cá mà mua xong cái sân này cái room ở đó cả abo cái mình quên rồi anh tiêu anh xong rồi phải anh siêu pants anh tiêu anh làm sexy so yêu cái gì những cái đi nhong đó so mình đi đọc cái tìm cô phật xây đêm mẹ vẫn tìm mấy cái mấy năm mẹ ấy vừa cái pastor thì mỗi bà nào tông bỏ xây như mấy cái dùng được nhớ sao mà nè anh năm sexy so cái đi ý kiếm cái August I mean, the time menstruation, my basu min can't get a coin. I want me. Kay do you know? Kay Tim me say na him. So, even a team maker who can have a work a report. I will get him me some minutes so. So, we are a body to say never to me. Cái coi hình được cái đó xí mọi cô bị bọn cái dài như đi đăng cái Facebook giá được xe phơi với cô xe được được xin yêu của dài như đi cái một xin này rồi như tầm mấy mai đi số bên ai bố quan tâm nhé anh này bên cái anh bị mai đi anh này bên này cả phơi dài cái tăng giá hoa nó đúng mà cô số cái những ai report đấy ibe ikore no awan do so nya ke ko ndra ke ni meri me nya dat police ali di mom am min yetim.
He told me that if I should say it to anyone that he will kill me. He said if I should say it out to anyone that there is no child that I've ever seen his or her father nakedness and say it to anybody that will go scot-free. So I was still scared when I said that, but I was tired. I did not want to be again in that bondage. Up from my 13 years till my 19 years, I couldn't bear it anymore.
In mitigating the impacts of these gross acts of human rights violation on its survivors, several interventions and measures are being taken by the United Nations Population Fund, the Norway Project, and in collaboration with the Akwa Ibom State government to support survivors. One of such is the FEREP in Akwa Ibom State, Nigeria.
First of all, I want to thank UNFPA for partnering with Akwa Ibom State and with FEREP. Through them, we've been able to establish a GBVC center. That center takes care of survivors, victims, and those that are threatened by the offenders. Currently, I think we have 2 or 3 young girls at the center. We had to take them off their parents because the culprits, the family of the culprits were trying to abduct the girls so that we will not have any evidence to show in the court. So that center is there. Not only the girls, even the parents, especially the mothers of the victims, are being sheltered there temporarily. Some of them, after that, we have to look for accommodation for them. So with the partnership with the UNFPA, advocacy programs have been going out also, talking to community leaders, traditional rulers about this GBV.
And the issues of gender-based violence have been on the front burner a lot in recent times. So the intervention of UNFPA and the Norway Project, and in providing enlightenment and bringing this to the front burner has been very helpful. This has been provided by the agency or through the platform of the First Lady of the state, and they've done quite a marvelous job.
A lot of the children, the vulnerable children, FEREB has been able to send them to school. We've done educational support, medical support. We've done a lot of support. We've even given a lot shelter of hope. Built a brand new shelter for some of these homes that we know that, look, we cannot take away one child and leave, so let them stay with their parents. So we've built houses for them, still under this Norway Project.
We've spoken to the chiefs, paramount rulers, and other community leaders, including health workers. We have spoken to first responders of to gender-based violence, and together we shared experiences and we also shared challenges, and we were able to know the areas that still needed much coverage, which is what has enabled us to ensure that every time we take a step further in the fight against GBV, we learn new challenges and we're able to accommodate the challenges, and we're still fighting on, and we're trusting that we'll be able to get there in no distant time.
I personally look forward to that day when gender-based violence will be reduced to the barest minimum. And going forward from here, we will also continue to interact and ensure that the necessary, apart from enlightening people to bring up issues of gender-based violence, but the necessary wherewithal to be able to intervene to ensure that those who may suffer such violence are taken care of in ways that minimize the injuries, both physical, psychological, and otherwise, of such violence is taken care of.
How far we go depends on all instruments of law and order put in place, domesticated, and implemented to rid the society of GBV and to finish the fight.
I lost hope. All hope was gone. I never knew I would still get back my happiness. I never knew I would be what I am today. I never knew. But I'm just happy that God has saved my life. On the 28th of August 2019, He came and brought me to FEREB. So when I came, that was the last day. That was the day that I know that God is still with me. That was the day that I know that God is still taking care of me. That was the note that I am fortunate, as my name said. That was the day that I know that God will forever be with me.
been able to have advocacy programs for rural women through community leaders, religious leaders, and all other stakeholders. What do we do in those meetings? Just to teach women what they should do when they are pregnant, encourage them to attend antenatal classes. We have primary health centers that takes care of these women, and the advocacy is going on to encourage women to attend antenatal. It's when they attend antenatal classes that they will discover if they have any problem with their pregnancy. They will teach them about nutrition, how to feed well during pregnancy, and as well as how to take care of the babies when they are born. So with partnership with UNFPA, we have enlarged our coast in advocacy programs.
In fact, make a fun, Kidem Mignon New Fang, Agesido, Nkengwam, Benegan, no Wumbo, Boxen no. Irami many again, Peron Compem and Irami. And yes, we go to Ekama, Again no mean. Because me wait a few fibo, me wait in Amtomo, I'm in Kupo. And Temin don't want me came Benusong. Benusong came in don't want me. And one mean, I made explain, Mpom no Iban. I can mean near Gifio. I mean, Mebo Yarabasi. I can Nama, Yaramin Kubinem, I took golf menem. Yaraba said also got I move sway introduce bomb kirang give meet because we work again pay manna. But don't get some man some fun be fun by some 12 or 20. But to get family planning me, I mean 6.
I was pregnant when I was in JS2. So coming here for antenatal, I was heard about family planning, which I didn't know. So after delivery, I came here for the family planning. So I'm now seeing the benefit of family planning. Even in my health, I've been able to gain some strength more than before. And right now, I'm able to do some business, like sober business to feed up my child. I advised some of my friends to come here for the family planning. Some of them they do come here to receive the family planning.
So make it fun, a family plan. It didn't I want them how reviews. Work again. Say I'm in Benny. It don't make it that game menu for the Kinamo team. Menu for the game number who forgot you for a Ben Bonk and Yamin. I mean, I could say in Sunday to from.
These days, men really appreciate family planning. Because of the outreaches that we go to the community, we give sensitization and they accept it. We tell them the benefit of family planning to the mother, to the child, and to the father, and also to the community and society as large. So the men now partners their wives to the facility to choose any of the family planning method.
Akwa Ibom State has benefited immensely in the areas of family planning, unwanted pregnancy, and the wherewithal to prevent unwanted pregnancy. And I can also only imagine that the UNFPA, and particularly the Norway Project that we are dealing with, has also been able to achieve its objective of reaching out and providing the help that it does.
UNFPA has partnered with the states in the Norway Project, and they have really made remarkable improvements in the family planning space in Akwa Ibom State. I want to say that they have done so well. They trained nurses on long-acting reversible contraceptives to work in the health facilities in the state. And these nurses that were trained were followed up, and they made sure that these nurses are providing services according to the set standards.
With the work of UNFPA and the Norway Project, it has provided a good opportunity to ensure that unwanted pregnancy is reduced. And this has been through providing the necessary wherewithal, including family planning commodities, training the necessary staff to be able to provide these family planning commodities, and then following up on the women to make sure that they use them properly.
We've gained a whole lot from the Norway Project in Akwa Ibom State. For example, like if through the PPFN, we've had the 72-hour makeover, which has so far between 2019 and now, it has happened in 75 health facilities across about 14 local governments. And these are things that were not there before now, but through the Norwegian government, we'll be able to have all those things in place.
They does for us, they equip the place for us, and they back us up with the commodities and consumables and with some equipment that we can use and work here. And they train me also to go to the communities for outreach for Sayana Press. And we have a very good data in this facility because of the assistance to us in this facility.
They also went further to train community health extension workers. The work of the community health extension workers does not only stop in the facility, they go down to the community level, and the Norway Project trained them on Sayana Press, that is the DMPS subcut, and they go into the communities and carry out outreaches whereby women in the communities come out and access services. These outreaches are carried out monthly in the different communities, and at the end of the month, a lot of women that were not reached are reached, and we have a good harvest of women coming out to access family planning services in our communities in Akwa Ibom State.
Under the Norway Project, a total of 382 healthcare providers will be trained. That's making up of 135 nurses and 242 community health extension workers. And so far, we've broken the training program into phases. And so far in the first phase, we were able to train about 126 community health extension workers. And in the second phase, we trained 30 community health extension workers. And in this last quarter, we are about to train 91 community health extension workers. And we have already started the training. So we are training in batches. So now currently we are training 31. And after this training, another batch of 30 would add up and another batch of 30 will add up. So at the end of it all, we'll be able to train about 243 community health extension workers. And we've already concluded on the training of nurses, which is about 135 nurses.
The project is a huge success, and I actually feel like we have a better word to use to show you how happy we are. And Akwa Ibom State government, we still continue to ask for support from the Norwegian government, and we want this thing to continue, even though we are also making our own plans for sustainability, because in case UNFPA says tomorrow, okay, let's move somewhere else, we've been in Akwa Ibom, which we pray and hope they don't do that very soon. But we're also working to make sure that we'll be able to sustain what UNFPA has been doing in the States.